Welcome to the call, everybody. Um, Today we're going to talk about special needs, both dual eligible and chronic plans. But before we get into that, let me just remind you, if you guys are team builders or if you're looking to get assistance recruiting, Gabe is available for that. Best way to do that is just go into his Calendly and set an appointment with him, and he will help you guys talk to other folks about coming on board. So with that being said, let's just jump right into the training. I don't anticipate today is going to be a full hour, but so that'll leave a lot of time for questions. Hopefully I'll get through this without choking to death. Okay, so let me share my screen. Before we get started, let's review a little bit of the resources that are available to you guys. Inside of the LBA website, if you go into the resources, media center, my computer's not going to work fast today for some reason. Inside of making the sale, these are all the documents that I already have prepared for you guys. They're already all up here for you to look at. So a couple of them that I'm going to use today is the page 2.3. That page will help to identify some needs. And then also, depending on what state you're in, you're probably going to want to pull up the state assistance program for your dual eligible people. So I've already done those. So I'm going to use Florida as my example for dual eligible. So what does dual eligible means? Basically what it means is they're eligible for assistance above and beyond original Medicare. So there's a few levels that we need to be considering when we're working with our clients. The first level is low-income subsidy, which I do not have on the screen right now because it's a federal program. That one is done through SSA.gov. Matter of fact, since we have a little bit of extra time today, I'll go ahead and show you guys how to do that. SSA.gov. Of course, they got all kinds of stuff on this site, but one of the things that you should be able to go down into is applying for extra help. Actually, I don't see this yet. I love it when they change things on me. Okay, so extra help with Medicare prescription drugs. You click right into that and find out if you qualify, right? Or you can, if you realize that they qualify, you can go right into the application itself. So why is that important? Well, LIS is one of those things that is going to help your client overall throughout the year and with their probably monthly usage. So what the LIS program does, the Extra Help program, is it reduces their cost for drug coverage. If you guys remember, I was talking about page 4, there's your 3 basic categories of how the drug coverage works. The last coverage area is the catastrophic coverage. Once somebody is approved for a low-income subsidy or the Extra Help program, they automatically go into the catastrophic copay structure. So they don't have to worry about the coverage gap. They don't have to worry about their normal copays that the plan would have. The Extra Help program is going to put them right into that limitation. So their brand name drugs will be more or no more than about $15, and their generic drugs will be no more than about $5. And that's true for any category. So if you're not familiar with what I'm talking about, I encourage you to go back to the page 4 training and look at that. Or look at the page 4 sheet that's inside of LBA, which is right in here. Page 4 drug coverage. It'll explain what those costs are inside of there. So not only do we help the client with their cost of drug coverage, but now once we get them an LIS status with the state or through Medicare, then they also are eligible to maneuver their plans more frequently. So as you guys can realize, right now is open enrollment. That will end December 7th, and there'll be a little bit of a lock-in period. Starting January through March, there'll be a one-time enrollment period that will allow a client, if they have changed plans or if they picked up a plan and they're not happy with it, during those first 3 months of the year, that client can change one more time if they have no other special enrollment periods available to them. So outside of that, the remainder of the year, most people are locked into the plan that they have chosen. And LIS status will allow them to change pretty much the remainder of the year. So that's important because people who are on lower income usually have different needs. And if they're picking a plan based on, let's say, some of the ancillary benefits like dental or vision, or they put a lot of emphasis on that and they didn't really think about what the hospital stay is going to look like, and they end up in the hospital, or they have a condition that pops up on them and their needs change, that additional special enrollment period that allows them to change whenever can be very important. So not only does the Extra Help program help them to lower their drug costs, but it allows them to change their plan more frequently. And as the agent of record, that's a good resource to have in your back pocket. Something that allows you to tell your client, hey, if you ever have problems, just reach out to me and we'll find a solution for you, even if that means changing your plan. So that's Extra Help. Again, SSA.gov. You can go into Extra Help with prescription drug cost, and then you can go through the pre-qualifier, or you can go right into the application and help them apply for those benefits. So going back to other dual eligible, there's 3 other categories that we're looking at for dual eligibility. When a Medicare plan references dual eligibility, they're not referencing the low income subsidy or the Extra Help. They're referencing these statuses here. And I wanted to go over these for just a minute and explain what those are. These are the different levels of Medicaid. There's actually a 4th level of Medicaid. It's working individual, but that really doesn't apply to most plans. The plans that we'll work with for dual eligibility will reference these 3 levels. And this is actually the Florida state assistance programs that I posted in the LBA website. So if you want to take a look at this and you're in Florida, you're welcome to. Or your state is probably in there, because any state that has assistance, I posted those into the LBA website there for you guys. So let's break these down, starting at the bottom where it says qualified individual. A qualified individual means that they are eligible for the Medicare Savings Program. What that means is they have an income low enough that the state that they reside in will pay for their Part B premium. Okay, so that $170.10 that they have been or will be paying to Social Security from their Medicare is put back into their Social Security check if they are found eligible for a QI1 status. Now, outside of that, it doesn't really do too many other things. However, with the QI1 or the qualified individual and the level above that, the special low income Medicare beneficiary, which is also referred to as a Slim B, those 2 are considered partial Medicaid. Okay, so I almost wish that we could have a big line right here that separates the top one from the bottom 2, because it's important to understand how those work with Medicare plans. So QI1 basically just pays the Part B premium, but it is a partial Medicaid plan. SLMB or Slim B Plus or Slim B will also be a partial Medicaid, but you could see the income is a little bit different. And the reason it's different is because they gain a little bit more when it comes to their cost sharing with original Medicare. And it may make them eligible for more plans when it comes to Medicare Advantage. But in general, those two levels are considered partial Medicaid. So when we look at plans that are dual eligible, we have to be mindful if they are a partial Medicaid, how that partial Medicaid is going to interact with that plan versus if they were a full Medicaid. And that's what the last level, or the top tier there, is a QMB, or a qualified Medicare beneficiary. That one is full Medicaid. You can see from the income level of $11.37 a month, that is not very high income. And so the state provides a lot of assistance to those people. What they do is they pay the Part B premium, but they also pay co-pays, co-insurances, and deductibles for all of their medical. So when a private insurance company can take somebody who has that assistance from the state and the Medicare and combine it together into one plan, they're offering not only a zero copay structure for their health, but they're allowed to get additional benefits like dental, vision, transportation, flex cards, and a wide array of other benefits at a much higher level than the normal Medicare recipient would be able to get. So let me give you an example of what that looks like. So if I went into, let's say, my Sunfire, right? I have different plans. I have D-SNPs, I have C-SNPs, and the difference here is this is dual eligible versus, where's my C-SNPs, versus chronic. We're going to touch on the chronics in just a little bit, but let's go into one of the D-SNPs and let's take a look at, see what this looks like. Okay, so excuse me. There's going to be some things in this that make sense and don't make sense. So for example, monthly premium is $0. Well, that makes sense because they don't make a lot of money. In-network maximum out of pocket is $0. Well, then why would the combined maximum out of pocket be $75.50, right? Well, they're not allowed to go outside of network. So I'm sorry, no, this is a PPO, isn't it? Okay, so let me take that back. In a PPO, they would be allowed to go out of network. However, because it is a PPO, they'll have an in and out of network cost sharing. Generally, they won't have cost sharing as long as they stay in network. If they come out of network, it really depends on the doctor that's out of network and why they're out of network. So in other words, how much they participate. So that combined maximum out of pocket is kind of like a safeguard. To be honest with you, that 7,400 is the majority of that 7,550. So I think you'll find that most of the dual plans will not have much that the patient is responsible as far as cost. Okay, so let's get into how we look at this here. So cost sharing amounts assume member is protected by the state Medicaid. So a couple of things to realize with Medicaid and dual eligible. People on Medicaid can lose their eligibility. So this is why you've got notes like this. The plan is assuming that they have their benefits in place. If they lose their benefits, one of a couple things will happen. One is they'll be receiving a letter saying that they're not eligible for the plan anymore. The second thing that will happen is that their cost sharing structure will change based on their eligibility status. So if they lose their Medicaid and they're still on this plan, you can see here, you might have to pay copays, right? Some other assumptions with Medicaid and Medicare. So the qualifications for extra help is going to be more forgiving than any of the Medicaid levels. So even the QI1 that just takes care of the Part B. So again, another assumption that this plan will have is that they will have low-income subsidy along with their Medicaid status. So you'll see there's $0 copay on all tiers for Medicare. And it's based on your low income subsidy level, right? This plan is basically identifying that you need to have these things already in place before you join this plan so that the cost sharing comes from Medicare and Medicaid together. Otherwise, there becomes issues, right? So why would a plan like this be better other than just regular cost sharing? So you got things like meal benefits, you've got a flex card, a personal emergency response, you've even got wigs, lots of different things for the dual eligible. And let me give you some idea of why that is. The mindset in the low-income subsidies is that people in these groups don't have the ability to necessarily buy the higher quality foods or have transportation to go to certain events like doctors. They had issues going to the pharmacies and things like that. So in recognition of that, the plans try to give them as much benefit as possible to try to entice them to come on. Most D-SNP plans automatically is going to assign a version of a nurse case manager to these clients to try to help them to become preventative instead of reactive with their healthcare. So the idea behind a D-SNP or a C-SNP plan is that they are going to try to get them to maintain health and even grow their health versus allow their health to overtake them. Okay. Same thing with things like dental. Most dentals you'll see don't have much of comprehensive. This has a comprehensive package that's pretty good. Includes $3,000 of dental every year for treatment. You won't find that in a core plan. You'll have to pay additional for something like that. What else on this plan? Actually, let me go down to another area here. Let's see. Okay. Summary benefits. What's nice about the Sunfire app is it does give you access to the summary of benefits. So in the summary of benefits, you can go down and you can look at something specific. And for this one, this is really where it is important to identify what they are. So it says to be eligible, right? QMBs are eligible. QMB plus, SLMBs, SLMB plus, and then full dual eligible and QI1, right? So on this one, what it says is any of those levels can sign up for this plan. Now, depending on your level of eligibility for assistance, you may or may not be subject to cost sharing requirements. The chart below is going to show you. So let's see if we can pop into this. Here's an example of what that means. So if you were a full Medicaid, and again, referencing back to the state programs, right? You've got QI1 and SLMB, which are partial, and QMB, which is full, right? Referencing those, a full Medicaid would not have a monthly plan premium, where a partial would have up to $37.30 for their monthly premium to be on this plan. You might think, well, why would somebody want to pay $37.30 for their plan when I can go in to get a regular Humana plan and not have to get those benefits? Well, it's because of the other benefits that are inside of it, the dental, the transportation, the flex card, and things like that. Okay. So I like to make sure that you guys understand that you have to look at, if they're not a full Medicaid, how that plan will work with their Medicaid. In general, I usually tell the patients, if they're not a full Medicaid, I really need to look at how it interacts with the plan before I give them a good advice on whether that plan is going to work with them or not. Okay. So there is your there's your idea of dual eligible. And again, inside of LBA, I've got all the different Georgia, Florida, California, Colorado. If a state has a state assistance program, I have that in there for you. You can see what those levels are and how it works, and sometimes how to apply. Now let's jump over into the other side, which will be your chronic plans. So chronic plans means that they have some kind of chronic illness that makes them eligible for a special plan. Okay. Before we get into this one, what will most likely happen is you'll have a form that needs to be done either during the time of enrollment or close to the time of enrollment. That's like a pre-qualification form. And so it'll ask you specific questions. This one is for people who have diabetes or cardiovascular disease. So it's going to ask you specific questions, and then it's going to ask you for the provider's information right here. The plan is going to go back and verify this information with the provider. And then once you put that information in there, which you'll want to make sure it's accurate, once you submit a plan for a special, for a C-SNP, let's say, the plan has 21 days to verify. If they cannot verify that this person has this issue that's signed off by their doctor within 21 days, they have to release that person from that plan. So they won't be on that plan if they can't get a hold of the healthcare provider to say, yes, this is verified. So just keep in mind that anytime you do a C-SNP, a chronic plan, you'll have to do some kind of verification form. And again, the provider will have to sign off on what that is and then send that up into the health plan. Okay. So looking at how we get to those, we can go in Sunfire, and let me actually back up for a second so I can show you how I got here. So I'm actually doing, I believe this is a Georgia address, and instead of doing original Medicare Advantage, I'm going to just do special needs. And then I'm looking for next year, 2023. I'm not worried about any of that stuff at the moment. And then I'm going to view all plans. So it's going to show me both D-SNPs and my C-SNPs, and then also I-SNPs. Now, I'll just tell you guys now, a lot of you probably are wondering what the heck is an I-SNP. An I-SNP is something that you will not have access to. It is an institutional special needs plan. Only people who work directly for insurance carriers will have access to those. And generally, those do not pay any commission anyway. So those are not things that we want to get involved in. Chronic plans, we'll look at this Humana. Oops. Go into the details. Okay. So just like a D-SNP, there'll be some advantages to this plan. This one, maximum out of pocket, it's a little bit high, but it's just the area that it's in. There are no medical deductibles. for the most part, you'll find that this will match very closely to a lot of the other plans that are available for people who are non-diabetic, a regular core plan. Where you will find the difference in something like this is where they pay for, let's say, diabetic supplies and services, right? Anything that's Medicare diabetic supply is going to have no cost to it, where on a regular core plan, they might have to pay 20%. They'll also include the therapeutic shoes or inserts at no cost. And then most of your testing should be covered. Is this a PPO? Yeah, it's PPO. So as long as they stay in network, they wouldn't have any cost for their procedures and tests. That's why you have two different cost structures here. Additional benefits we're going to get into in just a second. Okay. Okay. I like using the summary of benefits. It usually goes into a lot more detail. So again, we can go into this one and we can find out, well, let's see, what makes them eligible. To join the eligible diabetes and heart CSNP, you must be entitled to A and B, diagnosed with either CVD or diabetes and live within the service area. So not a ton of requirement there, but again, the doctor would have to sign off on one of the certifying letters that says, yes, this patient does have this specific illness. Okay. Okay, so again, they're going to give some additional dental. They're going to get the labs, doctor visits, no cost, a little bit extended vision for that particular plan, and then transportation. So they're going to get 36 one-way trips for a year. That'll be covered by the plan. They don't have to pay anything for that. The other nice thing that you'll find about this plan, get down to it. Most plans will not cover anything that has to do with ED, erectile dysfunction, or weight loss, because this can be tied to diabetic or heart disease, which medicines in those categories can affect both of those areas. They will be additional drug coverage for these drugs for this plan. So if you have somebody that says, hey, you know, I'm diabetic, I've been trying to get my Cialis, I can't find a company that will do this. Well, this particular plan will give coverage for that because it is a special needs plan. It's identified that some of the medicines that could be taken could interfere with their lifestyle. Okay. In addition to regular care, you've got your Medicare covered foot care instead of podiatry. That's usually something that's not specifically covered. And then you'll find most of the other stuff is going to be pretty standard. DME, which is durable medical equipment, which is basically anything in this category here, is all 20%. That's pretty standard across all plans, but the diabetic monitoring supplies will be zero copay unless they go outside of network. So overall, this plan is, it's got a lot of the same features that a core plan will have with some additional benefits. You'll find that specific drugs for their own illness. So if it's a heart disease drug or a diabetic drug, they will be put into a lower tier. So, for example, you got select insulins in tier 3. You've got, let's see. You've got a tier 6 for this. So these are going to be your select care drugs. So again, depending on their illness, one of the reasons why somebody would want to join this plan, even though it looks very similar to a core plan, is because of the drug coverage. $0 copay for anything that falls within those categories. And for these plans, for the chronic plans, those are pretty much going to be anything that falls within that category. So for example, on this specific plan, diabetic medicines and heart disease medicines, they will be able to get at no cost. So that can be a big benefit. Some of the Novalogs and things like that, they can be $100 a month. And so that can be a big savings for a lot of those people going into a plan like this. The other benefit, just like being dual eligible, is that somebody who is identified as having a chronic illness, if they have a core plan throughout the year and then in June or July or something, they are found eligible or found to be diagnosed with one of these illnesses, a chronic plan can be signed up for any time during the year. So again, it's another resource for you as an agent to be able to put them into a plan, and you become their agent of record and help them going forward by finding a special election period. So a chronic enrollment is its own special enrollment. Now, what I will say about that is the only caveat to that is if they're on a chronic plan for diabetes and you meet with them and they want to become one of your clients and you want to move them to another plan that is covering the same chronic illness, you won't be able to use the chronic illness SEP. You'll have to find another SEP. So for example, the AEP or OEP or SPAP that we talked about in the previous one. So if you find yourself in that situation, I would say either review what we've talked about before or just give me a call. I'm pretty good about being able to identify the special enrollment periods that most everybody can qualify for. All right. So we kind of looked at CSNPs, DSNPs. You can go through Sunfire like I did, right? And just go look at the different plans here. You can also go through Medicare.gov. Again, just a little bit slightly different platform. So depending on what style layout you like, you can use either one. Inside of the Medicare, I'll just show you that real quick. Okay, so I think it was 31906. Advantage plan. Don't get any help. Next. I don't want to look at drugs right now. Okay. Keep that open. Oh, you know what? Seriously. Okay, so once we get into the plans, we can actually filter. And you'll see here, special needs plans. And it'll ask you, is it for chronic? Is it for Medicare and Medicaid or long-term care? Again, we will never use this last item because it is for institutional. But if I wanted to look at just the chronic plans, I can go ahead and apply that. And now it should only show me the chronic plans. If there's any, yeah, no. You shouldn't show me the other ones, but they do. So, but they will be identified, CSNPs. What's nice about the Medicare.gov and the Sunfire is you can always go ahead and look at comparing them. So I've got the one CSNP there. Let me find another one. Okay, so I can compare both of those side by side if I wanted to. Again, Sunfire will do the same thing for you. A lot of people like the layout of Medicare.gov, so you can just scroll through and see what exactly the plan differences are. This is a big one. As we get into the different cost structures, all that will be in there for you. And then the additional benefits should also be in there for you as well. So for example, like the diabetic supplies, the DME, what the transportation coverage is, et cetera, et cetera. So with that being said, that's kind of an overview of the D-SNPs and C-SNPs. I know I deal with them quite often. So for me, they are kind of a second nature kind of thing. But what I want to do now is kind of open it up, see what questions you guys might have on that.
I have a question.
Sure, go ahead.
So I was working this week with a C-SNP heart person.
Okay.
And the request was to get the drug costs down. There were two high cost drugs or meds. And I didn't see anything at zero. You were mentioning that the significant drugs to the condition are no charge. I didn't find that.
Okay.
I didn't know the plan you were, I don't know. I don't know if I need.
So when you were looking up the drugs, how did you look up the cost of the drugs?
I put the drugs in the profile, and then I went to CSNP and looked like you did for the different plans.
Okay, so did you look through Sunfire or Medicare.gov?
I was Sunfire.
Okay. All right, so let me pull up Sunfire here. Let me share my screen with you guys.
Are they supposed to be no charge, or is this just some plans?
Well, some drugs on some plans. So, but there is a caveat to that. So what zip code will we be working with?
22156.
Okay. So I want to look at special needs plans, right? And then yes.
Now, just to mention this, the one the person's on is the Optimum C-SNP, and it has that payback on it.
Okay.
You know what I mean by the Medicare payback.
Yeah, the Part B buyback. Mm-hmm.
Yeah, whatever. So I didn't know if that was a trade-off because they had, the drugs were less expensive than normal, but they weren't zero. They were still
Gotcha.
the 3,000 each.
And it's possible, what most companies will do is you're at a tier 6. So, tier 6 doesn't necessarily mean that it's always going to be 0. It could be $2, it could be $5, but it should be less than that tier 3, which is usually somewhere between $30 and $50. So that's how a lot of companies have done their tier 6s.
Oh, okay.
Yeah.
Yeah, they were, I think it still came to a couple hundred a month. It was 600 or more a month before this person started, looking into it. But
Sure.
it wasn't 0. So
Do you
what-
remember the medication names?
I knew you were going to ask that. I don't. I have to pull it up. There were 2 things for heart. One was for, there were 3, but one was pretty much free. I think that was a blood thinner.
Okay.
It's for AFib. I don't know what they are. I have to look them up.
Gotcha. So with the Centfire, you just go through this portion here, add the pharmacies and medications. And I'm sure you did that, right? So no extra help, low view plans.
Is there a way to look up just the drug? I thought in some training, you look up just the drug and find out the least expensive places for it.
Yeah, so to do it that way, I usually go to Medicare.gov.
And then it will show which plans.
Made you care.
I don't want to take all your time, but
No,
Yeah,
you're
I bet-
fine. This is good
Lost
stuff
it.
for everybody to see.
I
Right,
basically
so-
will lose it if I can't find something better.
Yeah.
So far,
So zip code again, 22.
33756.
So we'll say it's Atterbaston.
Oh, I think I have them in my phone. Let me see. Oh, I have them. One
Okay.
is Eliquis, which is a blood thinner. That might be the kind of free one. One is
Hold on. How do you spell that?
Eliquis, but I think that's the kind of free one, generic. Then there's, I think the most expensive, there's 2 expensive ones. You want those?
I'm ready.
One is Multac, MULTAQ.
Oh, shoot. 1 second. Oh my goodness. Okay.
You want the other one?
Yeah, give me 1 second. I'm sorry. All right. Okay. And then what was the last one?
It's DILTIAZEM CD. I don't know. I couldn't figure out the CD, but
And that's those 3 drugs, correct?
Yeah.
Okay. So we're done adding drugs.
what are you in now? It's too
This
small.
is- This is Medicare.gov.
Okay.
So we can look at mail order, and we can also look at 1 or 2 other pharmacies. So I'll do mail order, I'll do Publix, and I'll do, let's say Walgreens, right? Okay, so this is going to show me annual cost So it's saying that 21.70 and 70 cents for the Humana Gold. Care One is the same. 22 for Care One Platinum. Premier, Optimum, all about $2,300.
Oh, that's the total
Okay,
for the,
so now I need to look at my special needs plans, right? Because these are just core plans. So when I
oh,
apply the special needs to this, now it changes which ones are least expensive for the year as far as pharmaceutical side of things. So now Advantage Care is least expensive with a 1472 annualized. Okay. Now, if I want to get into the details of how that is, which I'm going to go ahead and show you a couple things here. We're going to compare that one with the Humana with let's see, Care One. Okay, so what I can do is take those three, I can compare them. I go down to the drug cost, and now it shows me how the cost is broken down. Okay, if I did mail order, if I did at Publix, if I did at Walgreens, right? So it shows me why it's less expensive for the Advantage Care, because I can get those medicines at Publix for $14.72 for the year. Versus if I go to Publix, it's $21.70. Or
You meant-
Walgreens,
oh, okay.
right? Or mail order, right? So it shows me in the details why that is. Does that make sense?
Yeah.
Okay.
So 1472 for the year for all three would be the lowest, pretty
It
much.
would. So then that's another question that you have for the client. Is Publix somewhere that you would be okay getting your pharmacy or having for your pharmacy? If they're like, well, I don't like Publix, I'd rather go to Walgreens, or I'd rather just have it mail ordered. Or if they're housebound and they can't go to Publix, well, now we look at mail order, right? And so in this case, it's still less expensive to go through the Advantage Care, but in many cases, you'll find that mail order is going to be the same cost across the board. So those are questions that you need to kind of dig into a little bit.
Mhm.
Is Publix going to be okay for you? Do you want to go somewhere else? And you would ask that question probably earlier when we were searching at the pharmacies. But I chose three just to give you an example of what the different costs would look like. And you
Okay.
can see that different places that you pick them up from can be different costs. So for example, even in this Advantage Care, Publix is less expensive than Walgreens, right? And the cost for mail order is even different than the other two. So when you're going through your data analysis with your client, when you're going through like your page 2 and 3, and you're asking them what if they want to identify the medicines, what they cost, and what pharmacy they go to, you might want to also ask them, are there alternatives? For example, Publix usually has a better deals for some drugs. Would you be open to different pharmacies? And if so, what would they be?
Okay.
Okay.
Thank you.
You're welcome.
I appreciate that.
What other questions do we have?
Hey, Carl, Glenn.
Hey, Glenn.
I was on with a client with a lead the other day, and I've gotten this same kind of question a couple of different times,
Okay.
and they've said something along the lines of, "Well, I've already got part A and B. I'm interested in the food help or the utilities help." Is what you were talking about with dual eligibility what they may be referring to? And then also, can you touch on the flex card, what it's used for, how they get it, what it's tied to, if there's a qualification or an eligibility for that, those kinds of things.
Okay, well, you're actually talking about a couple different things, right? So if I go into, let's say, one of these D-SNPs, right? Let's go into this United Healthcare for example. I'm sure they're going to have something like that in this plan. Okay, so a flex card can be the over-the-counter, right? So like, for example, this one is $230 per month for things that you can basically pick up at a Walgreens or something like that. Band-Aids, toothpaste, soaps, vitamins, over-the-counter medicines, things like that, right? So that's part of Medicare Advantage benefits. You also have other things like, let's see if this one has it. Okay, so this one doesn't have a flex card that I see. And the problem with answering your question directly is that different companies will call it different things. So over the counter sometimes is just called a flex card. Sometimes they call it a meal card. Sometimes a company will call it a flex card and you can get medicine or meat with it. So it's difficult to answer the question the way you described it. So what I will tell you is that just like what I mentioned with the different documents, right? You've got your, you're in Georgia, correct?
Yes.
Okay, so you got your state assistance programs for Georgia. That will eventually pull up. And then you have your Medicare Advantage plans that will have built-in benefits. So let me see if I can throw this into this real quick. Okay. So this is an example of Florida, right? These are people I've done Florida Medicaid applications for. And for those of you that are Florida agents, I will be going into a training on how to get you set up to be able to do this as well. I don't know if it's available in other states. I'm still doing research on that. But for Florida, we're going to show you how to become a master level so that you can go ahead and have people that you can research or file applications for on the Medicaid side. But just give you an example of what this would look like, right? So let me do a 2000. I really don't want to do all this here. New application. Okay, so this is not one of the correct. Okay, so for example, in Florida, when you apply for assistance, it's going to ask you what you want to apply for specifically. So SNAP is food assistance, right? Then you have cash assistance for different things, usually given to women or that are pregnant or newborn in the house, caretakers, different things, right? So to answer your question, Glenn, it kind of depends on what specifically they're looking for and if it can be identified within the Medicare Advantage plan or if it's specifically a state or federal benefit. So I think it was 2 weeks ago, I did a training on helping beyond Medicare, right? And so this is part of that. It's being able to separate how far you go with the client. And I know you and I talked about a specific client not too long ago. It's trying to draw that line, like where do we help them, where do we not, and what programs are available that they would qualify for. So inside of the Medicare Advantage plans, as long as they're eligible for the plan, they're going to get those benefits no matter what. So if I can find a solution within a Medicare Advantage plan, then I want to do that. And sometimes it makes me go into the summary benefits or look into the benefits beyond the medical to see if that fits that bill. And sometimes it makes me go into applications like this. Do I need to see if they're going to benefit from LIS? Will they benefit from the Medicare Savings Program? Should I help them try to get TANF or SNAP or something like that? You know, or are there other programs outside in the community that I can refer them to, right? Like Christian ministry or a soup kitchen or something like that. So it really kind of depends on what they're interested in. But if I can help them to see that inside of benefits, I can save them money, I can provide them additional benefits. Sometimes those needs are filled just by a Medicare Advantage plan alone. Now, if I can do other things for them and get them additional benefits that makes their life easier, then I will always do that. But you know, when you start going outside of the Medicare Advantage plans, you're getting a little bit outside of our wheelhouse. So even though we have E&O insurance, you never want to guarantee somebody that you can get them on Medicaid or you can get them on LIS because it's not technically part of our job. Does that make sense? Okay. All right. What other questions do we have? No other questions. Okay. Well, just like every week, I will post this recording in the LBA channel of Better. And I will also add it to, and just so you guys are tracking, I will add it to the LBA site. So where did it go? See everything. Well, there should be a Word document in here that has all the previous trainings. I don't see it in here right now, but it will be in there today because I have the document and I thought I posted it. I guess not. So I will have the link for this training inside of that Word document, which will be in there later today. Actually, it'll be there tomorrow now that I have to wait for the link, but you'll be able to access this training both from the link that I put into that Word document, which you can find on the LBA website, as well as on the legacy channel of the Better Network site. So with that, if nobody else has anything for me, I will
Hey, Carl,
say,
this is Tim. I'm a newbie, so I don't want to waste everybody else's time on it. But
sure.
since you're kind of at the end here, I was curious to know if I was going to start basically from scratch, you know, how you would recommend going about getting up to speed, you know, as quickly as possible. I do have my life and health license for Georgia, you know, so I got the state stuff knocked out, but I haven't done the, you know, the AHIP and the certifications for the different carriers. And then just to, you know, get up to speed to help clients. Just wondering what your best ideas would be for all that.
I would tell you to go through your AHIP and carrier certs first,
Okay.
because a lot of the training that I do is based off of those trainings, right?
Okay,
So
perfect.
it's
Yeah.
almost like you have to have that understanding to go into it.
Right.
And
Yeah. All right, that's super helpful because I was wondering about that, if I should watch your previous videos first or not. So that's helpful.
Yeah, no, I think it might confuse you if you do that, because I'm going to assume that you know some things that you might not.
Right.
So I would say go through your AHIP first for sure. And then you can do a combination from there. AHIP is going to be your core information that you need to know.
Right.
I don't go into anything necessarily specific outside of AHIP in my trainings. But you know, to be able to sell, you'll need the carriers anyways. So you can do the carriers in my videos simultaneously if you want to.
Okay, great. Yeah, that's helpful. And then how busy is it like after, after open enrollment, it's going to take me a little while to get up and running. So if we start taking leads, in through network.
So yeah, so that's a great question. So October 15th through December 7th, everybody looks at it as like, oh my goodness, that's the only enrollment period, which is
Right.
not true, right? You've got OEP, which is the time period we're in now. You have AEP, which is January 1st through March 31st, which is a one-time election for people to change again. So I always look at that as a second enrollment period. If I get in front of somebody and they like me enough to become their agent of record, the truth of the matter is I can usually find them a plan that's, if not the best, very similar to the best plan, just so I can become their agent of record, right? So I have 6 months right there that I can enroll people pretty much without having to look for an open enrollment period or a special enrollment period. When it comes to the rest of the year, that was the purpose of today's training, to talk about C-SNPs and D-SNPs that you can look at for the remainder of the year. And then you also have some other things. If you go through the training, I'll talk to you about how sometimes we're not able to generate enrollment periods, but I'm seasoned 20 years in this business. I'm very good at finding special enrollment periods. So I would tell you that in 100 people throughout the year, if they all came to me outside of any realistic enrollment period, I'd still be able to enroll 99 of those.
Okay, wow, yeah.
So we can keep you very busy. You just got to follow the systems, right? And we're going to talk when we round the first of the year, we're going to talk more about how to do marketing for outside of open enrollment as well. So that should play into how to keep you really busy.
Okay, great. Yeah, so the like I know with network insurance, and they have that the program you can get involved with where they're sending you to live calls and all. They do that all year long.
I believe so. Yeah, because you always have agents, you have people who move into a different county. All those are enrollment periods as well. So
Okay,
just
right.
to give you a statistic, there's 11,000 people a day that age into Medicare. So yeah.
Not super helpful. Yeah, appreciate it, Carl. Thanks.
Awesome. Okay. Well, we are a little past 1, so we're going to go ahead and close out this call. If you guys have any issues,